Assalamu alaikum and welcome back. Our today's video is about diagnosis and treatment option for heart attack. Before starting the video, I will let you know the diagnosis process for the heart attack and cardiac arrest is same. So I will not repeat the same thing again in this video. If anybody is interested to know about the diagnosis options, he or she should see my previous video which is on diagnosis and treatment option of cardiac arrest. I will give in description also. So I will go straight forward for the treatment option of heart attack. The first option for the heart attack is angioplasty. Angioplasty is a special tubing with the deflatable balloon and threaded with coronary arteries. After angioplasty is a angioplasty laser. This procedure is almost same like angioplasty, but the difference between angioplasty and angioplasty laser is there is laser beam on the catheter tip which open the blockage of the coronary arteries. The next one is artificial valve replacement. In this treatment, the surgeon will replace the damaged or malfunctioning valve of the heart. The next one is atherectomy. This is same like angioplasty, except the catheter tip is having a rotating shaver which will remove the plaque which is already stick with the wall of coronary arteries. Next is bypass surgery. In bypass surgery, the surgeon will take the arteries or vein from the leg or from the hand, and he will connect the vein from the with the coronary arteries from before the block, and then he will just bypass this blocking area, and he will reconnect again after this blocking area with the next vein. So in this way he will recover the blood supply. The next one is cardiomyoplasty. As it's clear by its name, cardio mean heart, myo mean muscles, plasty mean the plastic surgery. It's almost same. So in this one, the surgeon, this is like experimental procedure. The surgeon will take the muscles from the back or from the abdomen, and he will replace the heart damaged muscles. The next one is minimal invasive heart surgery. This surgery is alternative of standard bypass surgery. Next one is heart replacement. In this procedure, the cardiac surgeon, the heart surgeon will take the healthy heart which is donated by any person and will replace with the malfunctioning or diseased heart. The next one is radiofrequency ablation. In this procedure, a catheter with the electrode has been introduced by the vein till the heart muscle, and once it's reached to the heart muscle, the surgeon will destroy a very small area of the heart muscle. The next one is stent procedure. A stent is a wire mesh tube which is used to probe open the coronary arteries. Next one is transmyocardial revascularization. In this procedure, laser is used to drill the number of holes from outside of heart. These all procedure was surgical procedure for the heart attack. Now we will discuss about the medication, because there are number of medication which has been used even after surgery also. The patient need to use for the future safety, so the clot should not happen again. So first of all, we will discuss about the medication which is used, that is called anticoagulation. These medication prevent the blood clotting, because these are we called thinner, blood thinner also. The next is anti-platelets. These medication will not let the platelets to come in contact with each other and to stick with the artery walls to make a clot. The next one is angiotensin converting enzymes inhibitors. This medication expand the blood vessels and increase the blood flow into the blood vessels and decrease the effort of the heart to push the blood. The next one is angiotensin 2 receptor blockers. These medication control the blood pressure, because as I explained in above medication, that medication increase the blood flow in the vein, in the arteries, so it can increase the blood pressure. But these medication control the blood pressure. The next one is angiotensin receptor nephrolysine inhibitors. Nephrolysine is enzymes that break down into the body, which open the narrow arteries. The next is beta blocker. The beta blocker decrease the heart rate and blood flow, which lower the blood pressure and make heartbeat more slow. So if the heartbeat will be slow, the heart need less force to pump the blood. The next one is combined alpha and beta blockers. These used as a IV drips for those patients who experience high blood pressure crisis. Next one is calcium channel blockers. These medications interrupt the movement of the calcium into the cells of heart and blood vessels, which may decrease the heart pumping strength. The next one is diuretics. Diuretics help the body to get rid of the extra fluids. Till now we discussed about the surgical options and the medications. So there is one more topic which I want to add, that is antiplatelet therapy. Now it's coming in your mind, what is dual antiplatelet therapy? So let me explain. After the cardiac surgeries like bypass surgery or coronary artery bypass grafting, the doctor prescribed 2 antiplatelets medications, because the patient, if one time patient is having a clot, he or she is having a risk to develop another clot also. So in this situation, after the surgery, doctor prescribed 2 types of antiplatelet to save the patient for the future clots. I think it was clear for all of you. There are some other medications also been used by the doctors, but you know the medical field is very wide, so I will not go in too much detail. Right now we will discuss, as I discuss about these medications and surgical procedure. These are the most common procedure and the medications which the doctors or surgeon in the cardiac department are using. Hope you like my video. If you really like this kind of videos and you are interested to know more about the medical, please subscribe my channel, share these videos with your family and friend, and wait for my next video. Thank you so much for continued support.